Public Health Ontario says a number of cases of measles in the province has more than doubled in the past 2 weeks. Public Health Ontario is reporting 372 total cases since an outbreak began in October. That's a jump of 195 cases since the last numbers were reported on February 27th. There have also been outbreaks in New Brunswick, Quebec, and Manitoba. Health officials are encouraging anyone who believes they may have been exposed to measles to check their vaccination records. And Toronto General Hospital infectious diseases specialist Dr. Isaac Bogoch joins us live now with more on this increase in cases of measles in Ontario. Dr. Bogoch, it's good to see you, and thank you for joining us.
My pleasure, Lena.
So Public Health Ontario is describing this as a sharp increase in cases, and that obviously has medical experts all over very concerned. What stands out to you about the way measles is spreading in our province?
Well, I mean, if you just look at the numbers, it's I think the word is upsetting. I mean, if you look at 2025, we're only in mid-March. We have 346 cases reported so far this year. If we look at all of 2024, there were 64 cases all year. So this outbreak continues to grow, and we know that this is a very transmissible virus. It will find under-vaccinated and unvaccinated pockets. Remember, the vast majority of people in Canada are immune to measles. They've either had a prior infection because they were born in an era where vaccination wasn't commonly used, or they've received their vaccines, like the vast majority of people. However, we know there are pockets of under-vaccinated and unvaccinated individuals, and because this is such a transmissible virus, it'll find and exploit those pockets, and that's exactly what's happening now.
You talked about unvaccinated versus under-vaccinated. Can you help us understand the difference and why both are concerning to you?
Right. So this is a 2-dose vaccine. The first dose of the vaccine is given at the first year of life, and the second dose is given usually at about sometime between 18 months or before a child enters school. So it is a 2-dose vaccine. And when we look at the data in Canada, and of course here in Ontario, we can see that the vast majority of cases are in people who have not received the vaccine, or in people who may have received only 1 dose of a vaccine. Remember, though, kids under the age of 1 aren't eligible for the vaccine. So this is a very susceptible group. And but even the data suggests that most of these cases are in kids who are old enough to have received 2 doses of a vaccine. That's what's really troubling. These are people who have not been vaccinated for a variety of reasons, but they're not vaccinated. And and now we've got many measles cases. Over 300 cases of measles, and it's only March. So sadly, this will continue to grow until we ensure that everybody who is susceptible to this virus has the appropriate doses of the vaccine.
Right. And of course, there are the immunocompromised who can't get vaccinated, and they're very susceptible to this. What stands out to me here, Dr. Bogoch, is that in the past, cases in the province were mostly travel related, but we are beginning to see that change.
Oh, most certainly. So let's take a step back for a second. There's a large global resurgence of measles. This is not an Ontario issue or a Canada-specific issue. There's a very large global resurgence of measles. We're also living in an era with unprecedented human connectivity. People are traveling in numbers like never before. So it's inevitable. Someone's going to land in Canada with measles. That is going to happen. It's just going to happen. It's a fact of life. It's unfortunate, but that's what's going to happen. We can't control what happens outside of our country, but we sure can control what happens within our country. And it's our job and it's our responsibility to ensure that we have high rates of vaccination in the community. We want around 95%, such that when we see an inevitable imported case of measles, we don't see subsequent community transmission and outbreaks like what we're seeing now. That's the key. Ensure that the vaccine rates are high, 95+%, so we don't see community transmission when we get these inevitable imported cases.
There's a lot of misinformation, disinformation out there, and a lot of that has come from the COVID pandemic. How then do you talk to parents who are on edge, who are unsure? They might not call themselves vaccine hesitant or vaccine deniers, but they don't feel comfortable.
2 points here. I think when we think about disinformation regarding measles, this started decades ago with a false report of measles, being linked to autism, which of course is not true. And that paper was retracted, and we're still reeling from that 25 years later. Secondly, anyone who has hesitancy or questions or issues related to the vaccine, the best thing to do is to listen. to take that seriously. Shaming and blaming is not an effective public health strategy. It really sitting down, listening to people's concerns, and providing them and ensuring them that they have access to high quality information, and really addressing people's concerns and treating them like adults and treating them like normal people. So I think that's the best approach. And I think if we take an approach like that and have ways to enable people to make smart decisions for themselves and for their families, we'll see, high uptake of routine childhood immunizations, because outbreaks like this are completely preventable. There's no reason for us to have them, especially in 2025.
Okay. Dr. Isaac Bogoch, infectious diseases specialist at Toronto General Hospital. Thanks so much for your perspective. We appreciate the conversation.